our next question. This is from a nurse, and this has to do with child growth. And she had a few pediatric patients who fell off their growth curves after starting low carb. Now, we don't know what she means by low carb. We don't know what the food, and we don't know what the blood sugars were with the kids that went low carb. But this, she said this is a barrier. I guess she is a type 1 that is a low carber. But she said this is a huge barrier for her to advocate her way of eating in the clinic. Has this happened to any of your pediatric patients? And she said she suspected they're not eating enough protein.
So she answered part of the question correctly, but I can think of another part of the answer, and that would be to check the free T3. The thyroid may be low. We know that when people are eating less, especially if they lose weight or eat less carbohydrate, the deiodinase that converts T4 to T3, the deiodinases in certain tissues may lose some of their potency, and you may have to start giving these people T3 replacement, triiodothyronine. I find that most type 1 diabetics who come into my office already have hypothyroidism before I make any changes in their diets, but it is possible by lowering carbohydrate to also lower their T3, and that has to be checked.
Yeah, by the way, I saw a paper, one of the first papers that I saw that correlates and actually has a plot. It's a bar graph of A1C versus child growth, and I believe it's by a guy in Germany named Bonfig, and he had a statistically significant number of kids, and he showed that high blood sugars do indeed stunt growth. Did you see that paper?
I don't remember whether I saw it or not. I know that the first one to observe this was Bill Tamberlane at Yale, who I introduced to self-monitoring many years ago, and he immediately popularized the fact that when kids were diagnosed with diabetes, they drop off their growth curve, and when he got their blood sugars controlled, they'd go back on.
Right.
And that's the first thing that I learned about child growth and diabetes.
Yeah. That's my experience exactly with Dave. Yeah.
But we should look at their T3s.
Okay.
And to get the proper dosing of T3, it should be a timed release form that you can get from compounding chemists, and the doctor has to prescribe appropriate doses. You can get it to last about 12 hours, so you take it twice a day. And we have a session on that.
Right.